Hello, welcome to this NMC Test Competence OSCE video. I'm going to go through the clinical skills stations. I'm going to start with the administration of an inhaled medication. So my name is Hannah. I'm a UK nurse of 20 years and a university UK lecturer, and I've been a lead OSCE trainer. And when I started OSCE training, I found that there was lots of really poor quality and inaccurate videos on the internet, especially for clinical skills. So I'm making some resources to support you with your study. You can use it alongside the marking criteria. You can pause the video and you can complete the practice at the same time, and hopefully just to help you understand the requirements of the station and give you some clear up-to-date guidance. Okay, so administration of inhaled medication. This is one of the possible clinical skills that you may get. So you'll get 4 clinical skills out of the 22 clinical skills that there are in your OSCE. So I'm going to run through the station with you today. So it's a 12-minute clinical station, and the key things that you need to do in the station is first, you obviously need to read and confirm your prescription. Okay, so your inhaled medication is a inhaler. So you need to confirm the prescription. You then need to administer the prescribed inhaler correctly using a spacer. So that's using the blue spacer here. Okay, and you can buy these off Amazon if you want one to practice with at home. Just an aero spacer. You need to use and explain the correct breathing technique to your patient whilst you're administering the medication, and you need to document correctly on the medication chart that you've administered the medication. So what equipment will you have? So like I said, you'll either have the aero chamber, the spacer, the blue picture there. If you're a child OSCE student, you might have the one with the yellow one with the face mask, and you'll have a training inhaler like this in order to deliver the medication. What paperwork you're going to have? So you have your scenario, and then you'll have your medication administration record. So your scenario will be quite brief and simple. So for example, you're working on the respiratory ward and you've been asked to see Jessica Jones, who's been newly diagnosed with asthma, and to give the prescribed salbutamol inhaler for 12 o'clock. You'll have the timing on the bottom of that station as well. Okay, and then you'll have your medication administration record. You might have a single prescription chart, such as something like this, where this is all you have prescribed, or you might have a hospital chart like you have in your implementation station with a once-only medication prescribed or a regular medication prescribed. The key thing, no matter what type of prescription chart you have, that you're looking for and verbalizing for those 6 rights. So the date of the medication, the name of the medication, the route, the dose, the time, making sure the prescriber's signature and bleep are there, prescriber's name, and you've got the patient's details, so their name, date of birth, and hospital number if they're in a hospital, or name, date of birth, and address if you're in a community setting. So here I've got salbutamol inhaler, date is today, the dose is 100 micrograms, my time is 12 o'clock. I've got a prescriber's signature and name, Dr. T. Wilson, and a bleep of 890. Okay, I confirm this medication has not been given, and I check this against my patient details and then confirm my prescription is clear, valid, and legible. Okay, so I always like to break down the clinical skills stations into separate parts so you can try and have a mental roadmap of what you're going to do for each clinical skills station, because there's quite a lot to remember. So I break this station down into 7 different parts. So the first part is those key principles. Okay, we'll go through those, and it must include your ID and allergy checks because you are giving a medication. Then you're going to read the prescription and confirm it is clear, valid, and legible. Then you're going to go and collect your equipment and check your equipment and check the medication, check the inhaler matches your prescription. You need to explain the breathing technique to the patient and see whether they can do single breath technique or they need to do multi-breath technique. Then you need to administer the medication correctly. Then you need to document on the drug chart that you've administered the medication. And then you just need to finish your station, checking the patient's okay, ending the station professionally, giving any post-procedure advice if necessary. Okay, so to start off with, then starting with your key principles. So just very quickly checking it's safe to approach, ensuring privacy, patient privacy and dignity by ensuring you close the doors or shut the curtains, decontaminating your hands using that World Health Organization 7 steps. I'm going to introduce myself to the patient, saying, hello, my name is. I'm going to get them to ask to confirm to me their ID. So this is really essential in this station because you're giving a medication. So their name, date of birth, hospital number. I'm going to ask them to confirm their name and date of birth verbally, and I'm going to be checking that against the hospital wristband and my medication administration record, so my drug chart. Okay, must do an allergy check as well, and again confirming that against my documentation and confirming that if they have got an allergy that they've got the correct red wristband on. Then I'm going to explain my procedure. So I've come here to give you your inhaled medication. This is going to help ease your breathing with your asthma, and I'm going to explain how we're going to do that once I've got my equipment. Make sure they've given consent. Going to make sure just the patient's comfortable before I proceed, and then I'm going to move on to looking at my prescription chart. Okay, so exactly the same as you would do in your implementation station, you need to read that prescription chart correctly. Okay, so I need to read out any patient details, patient name, date of birth, hospital number. I need to read out the name of the allergies, if the patient's got any allergies, and that's documented on there. And I need to read out the date that the drug is due. Okay, so it should say today, the drug name, the dose, the route, the time, prescriber's name, signature. Okay, and it's really important you verbalize all those key points exactly the same as you would do in your implementation station. Okay, and once I've done that, I'm going to confirm that prescription is clear, valid, and legible. Then I'm going to go and get my equipment. Okay, so I would personally decontaminate my hands here because I'm going to go and collect equipment. I'm going to get my spacer. Okay, so I'm going to confirm that that is clean, intact. I'm going to get my inhaler. Okay, so my medication, and I'm going to check that medication against my prescription chart. So really clearly reading out that I've got salbutamol, might be 100 micrograms in a puff, the expiry date, which is on that, and verbalizing how many puffs of that medication you are going to give for what is prescribed. So if you're prescribed 100 micrograms and it's 100 micrograms a puff, I'm going to give 1 puff. Okay, if you're prescribed 200 micrograms, you'll need to give 2 puffs. So it's really important you verbalize that step. You do not need to wear PPE for this station. Okay, so don't waste time getting gloves and an apron. Okay, you don't need to do that. So I've got my equipment, coming back to the patient bedside. Now, really best practice is to do a double ID check, because obviously I've been away from the patient getting my equipment. I'm going to come back, I'm going to decontaminate my hands again because I'm coming back to the patient, and I'm going to ask them again to confirm their name and date of birth, and I'm going to check that against their wristband and my documentation, and then check the hospital number. I then need to assess if my patient can hold their breath for 10 seconds. And if they can, I'm going to use a single breath technique. If not, I'm going to use the multi-breath or tidal breathing technique. Okay, you only need to verbalize one technique correctly. Okay, so it is good practice to really ask your patient if they can hold their breath for 10 seconds. And if they can't, you'll need to use the tidal breathing technique. Okay, so how am I going to administer the medication? So really important, I need to ask my patient to sit up nice and tall. Okay, I'm going to remove the mouthpiece from the spacer, so that's the plastic end here. Okay, I'm going to shake my inhaler 2 to 4 seconds, 1, 2, 3, 4, and I'm going to insert it into the other end of the inhaler. So this end here is the rubber end, and my inhaler will insert into there. Okay, and then I'm going to administer the medication. Okay, so we're going to ask our patient to exhale, so breathe out completely all the way out, grab the inhaler, okay, and get them to put the hard plastic bit in between their teeth and lips, okay, and ensure their lips form a tight seal. That's a really important part to verbalize. Ask the person to tilt their head back slightly and just to inhale slowly and deeply, and you are going to depress the canister and administer the medication. Okay, so 1 puff at a time. And then if you are using single breath technique, you're going to ask the person to hold, breathe in slowly for 2 to 3 seconds, and then hold their breath for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're then going to remove the space of the mouth and ask them to exhale slowly through pursed lips. So like this. Okay, if they cannot hold their breath for 10 seconds when you've done that assessment at the beginning, you're going to do the tidal breathing technique. Okay, so again, get them to exhale fully, tight seal, lips, teeth round the spacer. Okay, you're going to get them to breathe in and out slowly. You're going to press the canister, and you're going to ask them just to breathe in and out 5 times. So 1, 2, 3, 4, 5. Okay, remove the spacer device from the patient. You then need to verbalize that you would wait 30 to 60 seconds between doses if it was the same medication. Okay, so if you needed to give a second puff, for example, and you would wait 2 to 3 minutes if it's a totally different medication. So it's important you verbalize that part to the examiner. Then you need to go on to your documentation. Okay, so explain to the patient that you've given the medication. You need to sign in the signature box. I've just highlighted that in purple here. And you'll need to add your date and time of your station. Okay, so your test date will be the date and whatever station time you've had in that station. So for example, it would be 12 o'clock here. Okay, no matter what form of prescription chart you have, and sometimes they can look a little bit different. You want to just always make sure you are putting your signature in, okay, and checking for a date and time. That's really important. So complete your documentation next. That's an assessed part of this station. Okay, and then I would check my patient is comfortable, make sure they don't need anything, explain that I would come back and reassess their breathing and make sure if that inhaler had worked, and we'll make sure there wasn't any side effects, within 20 minutes or so, and escalate to the doctors if needed. Okay, then you need to clean your spacer with the Sani cloths that part of the station. Okay, so you need to do that. I'd verbalise that I'm going to return the inhaler to the stored drug cupboard, and I'd finish my station off using my 7-hand steps, use my World Health Organization 7 steps of hand hygiene. Okay, and if I've got any time left at all, I'm just going to go back over and check that I've done my documentation correctly. So my top tips for the station is don't forget your ID check, allergy check. Really, really important because it is a medication you're given. Make sure you read the full prescription out, exactly the same as we do in the implementation station. So the date, okay, date often gets forgotten and is a fail. The time of the medication, the drug name, the dose, the route, prescriber's name, signature, bleep. Okay, verbalise your medication matches your drug chart when you get it out of your trolley. Okay, verbalise the expiry date and verbalise how many puffs you are going to give. Okay, learn the correct breathing technique, so either single breath or multi-breath. Okay, and you must verbalise that technique correctly. Okay, and make sure you document on the medication record. Okay, make sure you complete all parts. Okay, so check for a signature, a date and a time. Okay, I hope you have found this helpful. I'm going to be hopefully putting up some more clinical skills videos. You can use them to practice along at home. You can use them to pause. You can use them to write notes and revision notes. And also I'm available for tutoring online and face-to-face, where we can go through the skills. I'll give you immediate one-to-one feedback, and you'll also get access to my more detailed practical clinical skills videos as well. You can email me on hannah.lames@outlook.com or visit my Facebook page, Nurse Tutor Tutoring with Hannah. Like the video and subscribe, because I'm hopefully going to be getting some more clinical skills videos out for you.